Awesome. All right. Well, thank you everyone for joining us today for our Health Equity Work Group meeting. I'm going to officially turn it over to our co-chair, Christine Stewart, for our official welcome and icebreaker.
Oh, yes. Welcome, everyone. As you see, I've already put in the chat, and several of you have already done that. Please type your name and organization in the chat. We are recording for the record. I am again Christine Stewart. I've been the co-chair of this committee for a while, and we're asking you, in recognition of Walktober, how are you staying active? And if you haven't seen October, I know as a resident, I get things from the Parks and Planning and what is it, MNCPPC? Did I get it right?
It sounds right. And we're sorry if it's wrong, but that sounds right.
Got it. How are you all staying active?
So I can just share. So one thing that I'm doing is I'm walking 3 miles a day, rain or shine. And I'm taking pictures along the way. So every day I find something that is exemplary of autumn and the season changing. So I've been watching like the leaves slowly progressing and the sky is slowly changing. So it's been really cool. I've gotten some really cool pictures, but just kind of forcing myself to move because this is the season where I like to curl up in a blanket and not leave my house as much as I can, but I'm just forcing myself to move.
That's a really good idea. I love that. Taking pictures to document it. Oh, and Dr. Bauer, deep water walking in a pool. That sounds tough and
It's actually really
relaxing.
easy. I recommend it. It's easy.
Okay. Deep water. Okay.
Yeah, you can wear a little floaty device around your waist so you don't sink very easy. So, yeah. Got an injured back foot, so I have a colleague who said that actually everybody I know who's had a similar injury said they've used water to recover. So, and keep moving.
That's really cool.
See, Rodrigo walks his daughter from daycare every day after work. That's great. I know for myself, I've been taking my dogs on extra long walks. I love fall. It's perfect weather. It's not too hot, not too cold. And I love the sun, the intensity of the sun in the fall. So I find myself purposely trying to find the paths that maximize my exposure to the sun. Anybody else?
Stephanie Burke says, I walk my dogs but don't like the cold. Brr.
Today was a little colder than I expected. I definitely needed to double, which is why I was seeking out the sun anywhere, any way I could, because it was a lot colder in the shade. All right. Oh, 10,000 steps a day.
The wife makes him walk. I love that. Good. It's great bonding time. That's great. Way to stay active, everyone.
All
Right.
right. You want me to go over the agenda?
Yes, please.
Yeah, so as usual, we typically go over the work group vision. This week or this month, we'll be having a presentation from the University of Maryland's Horowitz Center for Health Literacy. We're joined by Dr. Bauer and Dr. Arantes or Marlene. We'll also have a community health improvement plan or CHIP update, community announcements, and then adjourn. This is a reminder, Prince George, our vision is for a Prince George's County where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender, gender identity, or health literacy skills.
Thank you. All right, so we will now have the pleasure of hearing from both Dr. Cynthia Bauer and Dr. Marlene Orantes from the University of Maryland Horowitz Center for Health Literacy. Many of us are no strangers to these two lovely ladies and their organization, as the history between the Horowitz Center, the Health Department, and the Coalition, as I've learned recently, goes back way before 2017. So we've got this work group, there was a health literacy subcommittee, and you all have worked effortlessly through the COVID-19 pandemic and beyond with your most recent collaboration in developing the Health Equity Champions curriculum. So thank you again to everyone for your tireless endeavors in making a difference in this county. And so before Dr. Bauer and Marlene present, I'd like to share a little bit more about them. And I'll read their bios here. Dr. Bauer is...
I was going to say, you don't have to do that. That's okay.
That's fine.
It's totally
Well,
fine.
I will share the slides and then you all will
Okay.
have access to those. And
Yeah.
then I have Marlene's bio and photo as well, but I will go ahead and turn it over to you all.
Yeah, I think it'd be more interesting to have a conversation than read our bios. So
Okay. I support that.
Yeah, so as Shanae said, the Horowitz Center has a really long history with the county, and it predates my time coming on as the director in January of 2017. And pre-pandemic, within this work group, there had been a a health literacy subcommittee within the health equity work group. I had been focused a lot on health literacy in clinical settings. And that's how I met many of the partners that we have continued with to this day. And I know this work group has a long history. So some of this may be just a refresher or a repeat for people. But when I asked Shanae, she thought there might be a lot of questions or discussion about what does health literacy mean sort of in the current information environment that we're in. So I think that's probably the more probably fruitful conversation that we could have. So Marlena, was there anything you wanted to add before we get started?
No, Dr. Bauer, just continue. At the end,
Okay.
I will
Okay.
add
Okay.
something.
Yeah.
Thank
And
you.
Marlena has been our work group representative now for I think has it been about the last year, Marlena, that you've been attending? Yeah.
Yeah, in October.
Yeah. So I think we've been pretty active work group member with a small pause during the pandemic. So next slide. Do I advance or? There we go. Great. Thank you. So as the work group already knows, from Healthy People 2030, there's these two dimensions to health literacy. The Horowitz Center also does a lot of work. I mean, the work that we do with local health departments, with coalitions, with community partners, we actually call community health literacy, but there is no official definition in Healthy People 2030 for community health literacy. But back in 2017, when the National Academies of Sciences, Engineering, and Medicine still had an active health literacy roundtable, we had done a literature review on community health literacy interventions. And so that goes back now a number of years, but I'd be happy to share that link with the work group because that could be a good baseline for thinking about projects that the work group might want to consider going forward. But for 2030, they expanded beyond personal health literacy into organizational health literacy, which is really the domain of this work group, because it's what can our organizations do to help people find, understand, use information for themselves and others. And I saw that Rodrigo is on the call, and we've done a lot of work with La Clinica. They've got health literacy really infused throughout their organization. They did a webinar several months ago talking about how their organizational health literacy approach. So if you missed that webinar, it's posted on the Horowitz Center website under Hub Events, and I would strongly encourage you to listen to that webinar to really understand what this organizational health literacy approach means in practice. Next slide. So just to remind people that health literacy, again, goes beyond what we do as individuals. I'm teaching a graduate class right now with doctoral students talking about the role of misinformation and whether it really undermines or affects health, or how it affects health literacy. And so we spent a lot of time about how people share information with others. So it's not just about how we find information for ourselves, but social media makes it so easy to share information with others that really the research is showing that social media is a big contributor to this information environment that we're facing today. And then less commonly talked about, but something that we work on a lot from the Horowitz Center, is how to encourage people to participate in their communities and also contribute to policymaking. So I know some of you know about and were part of the Maryland Commission on Public Health, which recently wrapped up its work after the last couple of years. And they held a series of community meetings to get input on the public health plan for the state. And that was a real challenge to get people to turn out to these public meetings and to offer their thoughts on what the public health infrastructure for the state of Maryland should look like. And in large part, it's because people don't know a lot about it. It's kind of, abstract or technical. And so that's an element of health literacy that we don't often think about, but I think certainly is something the work group could think about, and I know was part of the thinking around health equity champions. Next slide. So these are just some of the activities that we've talked about in the work group before, and I'd be curious to hear sort of the progress in some of these areas, but health literacy, really the proverbial rubber meets the road when we're really thinking about the programs, the activities, the services that we offer in the county. And health literacy goes to what we do as organizations when we're creating and distributing forms, how we're designing programs, what kinds of services we offer, and the information and directions we provide about those services, how our call centers function. So, maybe, I don't know how many organizations in the county run, very large call centers, but a lot of organizations will use scripts, or they will have a designated person whose job it is to, field a lot of these public phone calls. If you think about that information being provided orally as to, through these call centers, that also is a health literacy issue, because plain language, the way that we explain things, how much jargon we use, becomes part of how we run these call centers. We spend a lot of time talking to organizations about their websites, and really any information product that they're using can be a matter for health literacy. We know that with the recently legislated changes at the federal level about changes to Medicaid and how people are going to qualify for benefits and services, that many organizations are projecting that's going to create a huge barrier for people to continue to stay enrolled. So this is really the time to think about the health literacy issues in how we describe these benefits, how the services are offered, what are the instructions and the forms that people are offered, to make sure that it's not more onerous than the law requires, which is going to be probably bad enough based on what people are projecting. But really, how do we lower that bar to make it as easy as possible for people to stay enrolled in benefits and services? There are various kinds of applications that we ask people to fill out. I know, fortunately, because of some foot and back issues, I've been dealing with the medical care system quite a bit, and I've been filling out form after form and application after application for things. And that gets really complicated, right, in terms of like finding all the information that's required to fill out these forms accurately, knowing how to navigate these forms when they are, for the most part, delivered online, right? So a lot of these are online forms that you are kind of expected to fill out on your smartphone, because they assume that most people don't have laptops, even, that people are using their phones to complete these applications. So there's a number of health literacy issues raised when we ask people to complete these online applications and forms. It matters if we're using technical language and jargon when people are just trying to get basic questions answered, because we know that's a real turnoff for people. And of course, websites. Websites are a primary source of information about our programs and services. And so it really matters how we set up our websites and how people are able to navigate them. Next slide. So Shanae had mentioned, and I know this is part of some of the information you've already been providing, but just to remind people who may not know, but there is the Maryland Consumer Health Information Hub that went into effect in 2022, and we've been working now for the last 2.5 years on this. It designates the Horowitz Center as the state's consumer information hub, and this is part of what we do, is we work with all the counties and the LHICs on promoting plain language training, helping them review their materials, helping them find out where the bumps in the road and the barriers are for language access services. So I know that in Prince George's County, that's a big issue. There's quite a bit of focus on providing information materials in Spanish, but there are other languages used and spoken in the county. And what we have found is that once you get beyond Spanish, it becomes a lot more challenging for people in the community to find information in their preferred language. And then the last piece is to really help organizations with how they share or disseminate information out and think very strategically about how they do that. So the purpose of doing all this work, of course, is that we build this health literacy infrastructure for the state of Maryland. Since we've been doing this work, Governor Moore came into office as the governor for the state, and in 2024, he signed an executive order. And this was really with the encouragement of the disabilities community, and they see plain language as a disabilities rights strategy. And so in the executive order, it calls for the state to have a plain language plan, which does exist and has been published on the state's website. The group had to draft some plain language standards, and those align. So we participate in the work under the executive order. So we've made sure that the plain language work under the hub aligns with the plain language work under the executive order. The executive order covers state agencies, so each agency has to have a point of contact for this plain language work, and they have to begin reviewing their content for plain language. In large part, they're focused on their websites right now. And again, because this was really driven from a disability rights perspective, the overall goal from the way the executive order is framed is that we are trying to provide Marylanders accessible, easy to understand information. So you can see there's a lot of alignment between these two, but I wanted to make sure that you understood that there's both the law, which covers state and local agencies. So that's for the hub law. The executive order focuses on state agencies, but they are reinforcing in this focus on plain language. Next slide. I think I've presented this information before, but again, to refresh people's memories, that there are a number of laws on the books in Maryland that also reinforce this beyond these more recent efforts, that since 2012, and the Horowitz Center was a partner in promoting this, is that if a student goes through a health professional program, and that can be public health, or it can be a clinical program or an allied health program, they are supposed to receive education in cultural and linguistic competency and health literacy. We know that's not happening uniformly or with, necessarily comprehensive-ness, but it is always important to remind people involved in the education business that this is what we are supposed to be doing to meet this legislative requirement in the state. If you are a licensed health professional, right, and you are renewing your license, since 2017, the licensing boards are supposed to offer training in cultural and linguistic competency, health disparities, and health literacy. So what we know about that work is that there have been links, basically websites with links to things, but really nothing that's constitutes like a promotional program or like strong encouragement for these topics to be a big part of the license renewal process. So I think that's something that was something we worked a lot on during the subcommittee when we had the health literacy subcommittee. But that's something the work group could also consider, because that is something that health professionals have to do, is they have to reapply for their licenses periodically. And this would be one way to make sure that they get this exposure to this content as part of the license renewal. Maryland does have a patient bill of rights law that applies to patients using Maryland hospitals. We have taken that to as one of our priorities because we believe that the information that's available to people is not very understandable about these rights. If any of you have been in a Maryland hospital, maybe you've seen like a poster on the wall or maybe a laminated flyer or something that somebody gave to you maybe at pre-admission check-in. I think that there's a lot of opportunity to put the Patient Bill of Rights in plain language. So we have drafted some materials on that, and we are getting some review by some experts in this area. And we hope to have this out by the end of the year. And that would be a consumer-facing tool to help them understand, for example, that if they are a patient in a Maryland hospital, they actually have a legal right to information they can understand in their preferred language. That's part of the Patient Bill of Rights. And there are a number of other rights that are enumerated in that bill. Since 2022, there has been a law about equal access to public services for individuals of limiting English proficiency. And then in 2023, there was a push to make sure that oral health information in particular provided by the Maryland Department of Health Oral Health Office was in plain language. That was a very specific bill on some oral health issues. And they included in there that the Office of Oral Health had to go back and review its own information and make sure it was in plain language. So you can see that there's this, building history, legislative history in the state trying to get at these issues from a number of different angles. Next slide. So I mentioned the Commission on Public Health. They have finished their final report, and this is hopefully going to be used to set the direction for public health in the state. It's focused on state and local health departments, and I wanted to make sure that the work group knows that there had been a focused work group on communication and community engagement, and there are a number of recommendations from that work group that made it into the final report on building the communication infrastructure at the local level and how to use technology effectively to communicate with the public. So I think that could, reviewing that report and particularly reviewing those recommendations from that particular section could be something that the work group could take up as part of a future work plan. Next slide. So I think most of you who have heard us give our plain language presentations before know the so-called use case or business case for plain language, but just to remind people, we promote plain language because it makes information easier to understand, much faster to process, and much more realistic and related to people's everyday lives. But I think most people are not as familiar with sort of the ethical dimension of plain language. I think that it's hugely disrespectful to give people information that we don't think they will understand, right? That is jargon filled, it's dense, it's technical, it's too much, it's overwhelming. And so I think this plain language approach, if we are trying to act in an ethical and responsible way towards the county residents, then plain language is the way to go because it is inclusive of many abilities and it is respectful in saying like we as an organization are committed to making sure that we give you something that's useful as opposed to something that's going to basically be exclusionary and create too high of a bar for understanding. Next slide. So this is an example from some work we did in Frederick County during the pandemic. And so just to give you a sense of kind of the spectrum, and certainly Rodrigo and probably other people in the work group can add to this, is we created plain language information in English and we, we're distributing that. But then we also were working with community health workers to make sure that the information was not just translated, but was presented in a culturally appropriate way in people's preferred language. And then recognizing that community health workers needed to use these materials to explain the information orally, right? So the written material was going with the verbal explanation that the CHWs were offering when they were doing these vaccination clinics and health fairs and things like that. So this just kind of gives you a sense that there's sort of a spectrum of ways of thinking about when you need to provide information in languages other than English, you've got to really think about how that information is going to be used, and that plain language helps make this information much easier for somebody like a community health worker to use in a verbal exchange with somebody they're meeting at a health fair or clinic or such. Next slide. So we work under the hub, we work with pretty much everyone in the state. We do a lot of work with state and local governments. We do some work with hospitals and health systems. Because we work through the LHICs, we're engaging all the time with nonprofit and community-based organizations. This year in particular, we're focused on K through 12 and school health because there's a line in the hub law that says we're supposed to be contributing health literacy education for the K through 12 space. And that's not an area that we've done a lot in the past. So this year, meaning the rest of 2025 and into 2026, we're going to focus on this K through 12 opportunity. We work with elected officials, and a lot of our projects involve community health workers. Next slide. This is one of our primary tools that we encourage every organization to use. It's free. It's available on our website. It aligns with the the governor's executive order to have plain language standards for the state. This is a checklist that was based on the checklist used by the Maryland Health Benefit Exchange. And a work group that I manage under the hub has refined this checklist over time. So it's an Adobe fillable form. You can download it, you can fill it out, you can save it, you can share it. But this is the primary tool that we train people on in plain language these days. Next slide. The last kind of piece that I wanted to introduce you to is something that we just launched in September. I forget that we're already in October, but yes, in early September. And it's the Maryland Health Literacy Organizational SEAL Program. So in the hub law, it says that the Horowitz Center is supposed to create criteria and standards for how to implement health literacy at the organizational level. And so after talking with a lot of our partners, there was this request that we offer an organizational seal. So this isn't accreditation. We're not set up to be an accrediting body. But we have created a set of criteria that are at 3 levels: basic, intermediate, and advanced. And right now we're focused on state and local agencies. So it would be the Prince George's County Health Department that could apply for the seal. We're not really set up to have other organizations apply yet, but we're open to conversations about how that might happen in the future. But the seal basically says that the organization does 2 things. It prioritizes clear communication with the public, and it meets the health literacy and plain language criteria that are laid out under those 3 levels. So this information is all available on our website. The criteria are spelled out there, how to apply, all of the information. And we currently have a consultant, an hourly consultant, that is working with 2 state agencies and 2 local health departments that are going to be the first 4 organizations applying for the seal. So next slide. Again, it's any state or local agency that provides health, safety, social services, or health insurance information, and you can apply for any of the 3 levels. You don't have to start at the basic and kind of work your way up. If you feel like you meet all the criteria at level 3, you can go ahead and apply for level 3 from the beginning. Next slide. So some of the reasons that the SEAL program, I think organizations wanted the SEAL program, was it was a way for agencies to demonstrate what they're doing in this space, that they're actually being proactive in making information easy to understand and use. The other thing, which maybe is probably more subtle and maybe less appreciated, but from my perspective, equally important, is many organizations that we work with don't have policies and procedures about how they create their information. I was teaching this topic in my graduate seminar last night, and the analogy I gave to my students was, imagine you made t-shirts and you had a manufacturing, facility for making these t-shirts, and everybody who worked in this t-shirt factory got to decide what a small t-shirt looked like, what a medium t-shirt looked like, what a large t-shirt looked like, what an extra large t-shirt looked like. And they could all produce their own t-shirts, and then those were the t-shirts that were going to get labeled and put out to the public. That would be a pretty crazy system, right? Because everybody could, if you could have 10 people producing something labeled a small, and they could look all different ways, right? They could be different sizes, different shapes, whatever. But that is oftentimes how we produce health information, is we don't have any standards or procedures or guidelines that we follow. And so somebody in an organization gets tasked with creating it, and whether they have the background or not, or the experience or not, or a set of criteria or guidelines or not, they have to get something up on the website, or they have to get that form out, or something needs to be created. And so this is, to me, one of the most important things that the SEAL process can do, is have agencies go through that process of understanding what kinds of policies and procedures are we going to put in place, so that we know no matter who in our organization gets tasked with doing this, it's going to have a minimum set of criteria that it will meet. And I think that's a hugely important but very underappreciated benefit from going through the SEAL process. Next slide. So this is the link to the Maryland Consumer Health Information Hub, and also to the Center for Plain Language. I was very sad to learn this last week that the federal government has done away with its dedicated plain language website. So for 2 decades, there's been a website called plainlanguage.gov. It no longer exists. It went away as of about 2 weeks ago. And so that information, some of it, not all of it, but some of it has been folded into digital.gov, which is the federal government's website for digital services. So I would strongly encourage you to focus on the Center for Plain Language, because that is a nonprofit organization. It was founded by a lot of former federal employees many years ago with a real passion for plain language. They have a lot of resources on their website. The other thing is they run an awards program. So if your organization creates a really stellar plain language product, you could actually enter it into their awards competition, which is great to get recognition for what you're doing. So I would encourage you, normally I would have sent you to plainlanguage.gov, but since it doesn't exist anymore, I will not send you there. But you can certainly come to us. And like I said, the Maryland the Maryland Plain Language Checklist really basically is a reflection of the old federal plain language guidelines, as well as some additional factors around language access. And I think that is my last slide. We would love it if you could provide feedback on this session. So every presentation we make to the LHICs, we're trying to get feedback about how to make these more useful, and to make sure that we're giving you the information you need to really begin implementing health literacy and plain language activities in your organization. So if you wouldn't mind just answering a few brief questions for us about today's presentation, that would be extremely helpful. So I think with that, do we have time, Shanae, for some conversation and discussion about this? Okay, I think the answer is yes. So I don't know.
I dropped the SurveyMonkey link.
Okay.
In case
okay, great.
People don't have their phones in front of them to scan the QR code.
Okay. So I think you do send out the slides, isn't that right? Stephanie asked, can I get a copy of the slides? Yeah, I think you do send out the slides. So questions, comments? Yeah. Go ahead, Christine.
I was asking if anybody has any questions before I jump in.
And Rodrigo, if you want to offer a testimonial about what you're doing at La Clinica, that's always welcome too.
And that's something I definitely wanted to follow up on, because I know at the top of your presentation, you mentioned that La Clinica did a webinar. I went on the website. I wasn't able to find it on how
Okay.
to integrate. Yeah, so
Marlena, can you drop that in the chat?
Yeah, yeah.
Oh.
I right now. Mhm.
Hello, can you hear me?
Yep.
yes.
Yeah, I can't see myself on camera, but I trust MB. So yeah, no, thank you so much, Dr. Bauer, for your thorough explanation of health literacy. So yeah, La Clínica has been fortunate to partner with the Horowitz Center in multiple phases. Most recently, they did like a very thorough curriculum to support the work of our medical interpreters, specifically to expand the scope of work beyond interpreting per the competencies of interpretation, which is to serve as a conduit, cultural broker, patient advocate, and clarifier. And it's sort of that clarifier perspective of how can the interpreter ensure the patient is understanding not only what happens during the appointment, but also navigate sort of like the broader health system. So we've been fortunate to implement a lot of those core lessons and core elements that the Horowitz Center shared with us. And but La Clínica has also been very intentional around health literacy, establishing guidelines, developing an assessment around health literacy, and it's sort of really guided our day-to-day work from the materials that we produce, how we produce them, sort of the language that we utilize, the intentionality of the plain language. Yeah, I don't know if there's anything else you want me to.
Well, I mean, so I guess, you've been there through all of this. You were one of the first people I talked to, Rodrigo, when you and Suyana, right? So I'm just curious from your perspective, how do you feel it's changed La Clinica? I know you ticked off the kind of activities that you're doing, but like in terms of the way that you feel like you interact with your clients and sort of how La Clinica responds, do you feel like you can have,
I think there's
either
a lot
from an
more
experiential or other
criteria.
perspective? What's that?
There's a lot more criteria of like the importance of plain language and anything at least that is represented in writing. There is a lot more, and I think I use criteria como criterio. I need some Spanish translation. Judgment, I would think would be the. I don't know if judgment is the correct terminology. I'm sorry, I'm flipping between Spanish and English, but like intentionality would be what I'm looking for. There's a lot more intentionality when producing writing materials, embedded in different committees. For example, we have a health communications committee. We do where we revise the materials that we produce. So yeah, that's how it's filtered. We are not at the step that you recommend. That is actually an institutional policy, but I think we're almost there in terms of how it's already a reality. It just needs to be formalized and put in writing in an official policy. But we do have style guides. We do have different committees that implement this.
Yeah, and I think, you guys have just really two things. Leadership, you've had the internal leadership that's made this happen, and you've kept plugging away at it. Because I mean, you guys went through the pandemic like everyone else. I know you've had you always have a lot of pressures, financial pressures, and need for services, and yet you stuck with it. You never said, "Oh, it's too much," right? We got to focus. You've just kept going, and I think that's one of the things I admire the most about like what a clinic is. Like, you've kept at it during all of those other stressors and pressures that every organization has to deal with, and so I'm just very impressed that you guys are sticking with it and making it happen.
Oh, thank you for the validation. Thank you.
Siania has a question.
Good afternoon, everybody. Thank you so very much, Dr. Bauer, for your wonderful presentation. I actually have a couple of questions. And obviously, health literacy is just so essential in navigating all the services that are available and making the right decision from the perspective of an individual. Now, when we talk about county government operations, right, and looking at the whole network of different providers and serving the whole population of the county, I was wondering if there are any tools to gauge at how well we're doing, right, with literacy overall countywide. So looking at the health literacy of our residents, and also looking at how well all the different stakeholders, all the different providers are actually, helping helping our residents to be more literate and make the best choices. So that's my first question. And then I also have a question, whether would you say that the use of 911 and specifically emergency medical services for low acuity non-emergency matters is really a health literacy matter? And do you have any best practices for addressing this particular concern? Thank you so very much.
Sure. So on the first one, I think the issue is going beyond these organizational assessments. So what we were talking about with La Clinica was, they've done they're an organization and they've done this work internally, but obviously we'd love to see many more organizations doing it, but there aren't a lot of examples of where like a collection of organizations or even a collection of county agencies or, state government. I mean, this is what we're trying to build out under the hub is like, so this work group that I mentioned, we meet monthly. It's a number of state agencies. We have 2 local health departments. And the idea is that you start to build this momentum across organizations so that you can start to see some effect. So for example, it's not just the Maryland Department of Health that's involved. It's the Maryland Department of Human Services. It's the Department of Aging. It's the Department of Disabilities. It's the Maryland Insurance Administration. It's the Maryland Health Benefit Exchange. Every one of those state agencies has a piece of the puzzle as far as, an individual resident or family member is concerned, right? Because we're going to need pieces of information from all of them. But Maryland is really the first state that's taking kind of this bigger picture approach and not just trying to do one organization at a time. The academic literature has published studies of individual organizations that have tried these methods that I'm talking about, but we're really the first place that I know of that's trying to do it on the scale that I've been talking about. So the place to think about evaluation metrics would be to look at actually the hub's own evaluation plan. And on our website, we've published, so we hired a third-party evaluator, and that third-party evaluator wrote an evaluation plan and a logic model. And that's for the work that the hub is supposed to do. The Horowitz Center is like the catalyst, but I mean, the kinds of like medium and longer term outcomes that we're talking about, they go to that point of that you need many organizations across like a county or a state to participate if you're really going to make sure that residents are well informed and able to make the best decisions for not only for their own health, but for community health. So I would encourage you to look at our own evaluation plan for the hub and I'd be happy to have follow-up conversations how you might think how we could talk about adapting that for the county, for example. On the point of personal health literacy, we have offered questions. I think Prince George's was actually one of the counties that we've offered some questions to from other surveys to use as part of the community health assessment work. But mainly because they are not comprehensive in the way that we would like to see, I'm working with a doctoral student on building a new personal health literacy assessment to pilot in Maryland. So that will be coming. It's, we're working on it. But right now, basically what we do is we have a small set of questions that we offer or we suggest that counties use as part of their community health assessments as an interim step. And then as far as 911, to me, that's like the difference between people going to an emergency department or an urgent care or their primary care. And I think it's a matter of informing people like what's the difference among these services and kind of reinforcing, that, you know, you're going to get better service if you call the right place. I know in Prince George's County, if you do call 311, for example, they will tell you if this is an emergency, call 911. If it's a non-emergency, call the county's non-emergency number. But I think that's the real challenge from the caller's perspective is what constitutes an emergency and what constitutes a non-emergency. And the only way to help people understand that is going to be through a public education and communication campaign. I don't see any other way around that. I mean, I'm president of my neighborhood civic association, and we deal with this all the time. We have these conversations at our association meetings. So yes, we can't even get people to take their trash cans in or use their composting bins correctly. So yes, this is an ongoing problem about educating county residents about a whole bunch of things.
Anybody else? I have a whole list of questions, but I know there's still another topic on our agenda. It's one question, and I thank you for, again, this presentation. I know this is not the first time the Horowitz Center has presented to this exact work group, but things have changed dramatically. Just even within the last year or two, we've seen like such the rise of misinformation, with the increased use of social media, and also AI, and the use of artificial intelligence. From your perspective, what are the challenges and the opportunities that may come with use of in terms of health literacy and artificial intelligence, and anything that we can do as a work group that can address either challenges or opportunities?
Well, so I was having this exchange with someone recently, and I said, you know, if any organization, even one with a massive website, wanted to just use any one of the existing AI tools to redo their website in plain language, they could get a pretty decent approximation pretty quickly. They'd still have to have people review it, and they still have to know something about the way to structure effective communication messages. So yes, I've not seen AI tools be able to do that. So for example, when I have used you know, an AI tool to try and create different versions of a plain language fact sheet, the prompt matters a lot, right? And so you have to know a little bit about what are the characteristics you're trying to achieve using an AI tool in order to write a good prompt that's going to get you an output that's going to look close enough to what you want. But you still, you can't give that to somebody to review who doesn't know anything about plain language and health literacy, because they won't be able to tell the difference between that being a product that meets the criteria and a product that doesn't meet the criteria. At the end of the day, you still need somebody who knows something about plain language and health literacy to evaluate the output. So I would say, if you're looking for something that's very fast to deal with a very large volume of information that you want to change quickly, an AI tool could help you do that, but you still got to have a very robust review process before you put that out to the public. That would be my recommendation if somebody came to us and said, how would you help us do that? That being said, I mentioned I teach this graduate course on misinformation, and yesterday I asked my students, because we were talking about the factors that fuel the spread of misinformation. And the research is pretty clear that social media is a big factor in doing that for a whole bunch of reasons. It's not just the algorithms, it's a lot of other reasons as well. And I said to my students, do you think there's any reasonable way we can get people to decrease their use of social media? And they didn't even take 1 second, and they uniformly answered no. They said no. And these are people in their 20s, right, who are in a PhD program, and they uniformly said no, right? So I think part of it is it's going to be virtually impossible for us to create enough Instagram posts and TikTok videos to compete with what's out there. So I think that public health has to kind of think about this problem differently. I think we've been trying to be in those channels And we're just getting flooded out, right? There's just the volume of information on those channels is just too huge to kind of break through. And when people do break through, oftentimes it's in a very negative way, right? People are getting attacked. There's a lot of hostility online and whatnot, right? So I was having this conversation with a different county yesterday, and I mean, I think it's really thinking about media in a much more local way. And it's like, how do we use media for the relationship building with the parts of the communities that we're already connected to, but also how do we think about media into the parts of the community we're not connected to? So I'm sure Rodrigo could tell us a lot about the kinds of media use among the clients that use the Clinica services. And that might vary from my part of the county where I live, and that might vary to, Upper Marlboro or other places, Largo, Laurel, right? Prince George is a huge county geographically, but also just in terms of the population variety. And so I think it's getting a lot more intentional about local media and what are some of the gaps in our local media structures, and how do we think about using local media more, like social media, in a more local way to kind of plug some of those information holes. Like we just finished a big set of interviews with community health workers for a project that we're doing. And almost all of them said that they use Facebook and WhatsApp, very, very heavily, both for communication amongst themselves and with the community members. So if we have those kinds of insights, then it's like, okay, how are we going to be intentional in using Facebook and WhatsApp within our communities if what we want to do is offer a counter narrative to what people are getting in those channels? That's how I think about it. Is like, I think we've been thinking about this as a big national problem, and we cannot change the national narrative right now. That's not, but I think we can if we say, if the county is our domain and we start to learn some about how people use media locally, how do we, as a public health collaborative, then engage with people through these social media channels in a more local and intentional way? That's my advice.
That's really great perspective, Dr. Bauer. That's great. Thank you for that. I think we have time for maybe one more question.
Yes, I'll jump in just from the perspective of a health center producing a lot of health information. I think, and sort of like echoing what Dr. Bauer was saying, that you can't compete with like the noise out there. So I think it's really important, and going to those public health solutions, actually like the material services and the actual services that people receive, because that is where a lot of the interactions happen. Regardless of the misinformation, people have to go to work. Regardless of the misinformation, people do get sick, and like you have to provide those culturally competent, and you have to, and just to repeat all the time, you have to be where people work, live, age, and identifying those specific areas in the community is where I think more impactful and fruitful distribution is than necessarily trying to flood social media. But that is just my perspective and sort of like the lessons that we try to implement in La Clinica as well.
And I mean, the county has to think about making itself a credible source, right? If the county wants people to look to, the county agencies want the residents to look to it, it's got to think about what are we going to do as an organization to build that credibility. It has to be, to use Rodrigo's term, intentional about it. You have to put it in your communication strategy. You have to invest time and resources in it. I know, as like I mentioned in my role as my volunteer community association president, I'm oftentimes that conduit because I'm signed up for everything that the county issues, right? So my inbox is getting flooded with all this stuff, and I kind of sort through it and figure out like how to package it and send it out through the neighborhood. But I'm always encouraging people to sign up themselves, because I said, the county offers so many, and I went to the county's Green Day last Saturday in Driscoll Park, right? I didn't see any of my neighbors there, even though I promoted it and whatever. I mean, it was pretty sparsely attended, and I know the county's done it several years in a row there. But I just think that we think we're promoting things, and I think it's just a drop in the bucket. And we have to really, as Rodrigo said, expose, repeat, and build those relationships to make ourselves, you know, a trust, as people say, a trusted source in the community. But that goes to acting in a credible way, being a credible source of information, not having people, you know, hear one thing and see another, right? I know then the community health worker data that I referenced, a lot of the community health workers said, you know, people are just pulling information from all over the place, and they just spent so much time saying, well, where did you get that from? Why do you think that's true? You know, can I share something else with you, right? So there are ways to help people reflect on their own beliefs and attitudes without, you know, getting into a big fight about it.
That's good. And I think it's important that there's cross collaboration too, and that we're working together. I mean, yes, we're one county, but we're multiple agencies within this county. And even with that, there's different messages going out. So like, how can we all come together to make sure that our messaging is the same, that we're using the same terminology, we're using plain language, that we're promoting each other's events and programs, because, you know, the health department is doing their thing, but University of Maryland might be doing their thing, but there's opportunity. Like we're trying to reach the same people. So how can we partner? How can we work together on all this? So I think that's important too. And things are still very siloed at times. And I understand why that is and the politics behind that and all that stuff. But I think there's a missed opportunity for more cohesion, for more collaboration across the board. And I think that we do a disservice to our county residents when we aren't cohesive and we aren't collaborative, even though we preach it, but we don't do it. And so, and it's not just, you know, what I see here, it's other counties I've worked with, other states I've lived in, it's like everywhere. And it's like, I'm just trying to figure out how can we break that and do better in that area. And I think that would just make a world of a difference. So, yeah. But thank you, Dr. Brown. This was really good.
You're welcome. And yeah, happy to be with you guys. Marlene is going to stay with you the last half hour, but it's good to see you all again.
Thank you. Thanks for
Take
everything.
care.
All right. Bye.
All right. Well, we will move on. I'm going to share my screen again. I know that Dr. Bauer mentioned a little bit, and I mentioned previously about the work that you all have done prior to my arrival here with the Health Equity Champions curriculum. I've heard great things about it, and I've seen the evidence of just your diligent efforts. So I do want to take a moment now to thank the Horowitz Center, to thank the Terrapin Think Tank students and this work group just for your dedication in developing this curriculum. It's been some time, as I've heard, but I have reached out to and worked with some of the staff at the health department to ensure that this work wasn't in vain. So I want to thank Ray and Taylor and her interns, Abisol and Krista. The curriculum has been updated with active links, some enhanced resources, and the webpage is now live and accessible through the PGC Health Zone webpage. So I put the link on this slide, which you'll be able to access when I send that to you, or you can just search directly on the page. But I will make sure I get this out to you all by tomorrow at the latest. Christine?
Yeah, can I just, and I missed this earlier, just terminology distinction. So the Health Equity Champions curriculum was like a larger training. And then what's on the Health Zone website was kind of like an interim product with resources that kind of aligned with the curriculum. So I just wanted to make that distinction.
Thank you.
And I missed that before. I'm sorry.
Thank you for clarifying. I appreciate that. Still learning it all. I'm still learning the language and all that stuff. So I appreciate everyone's patience with me. Thank you. Thank you. Yeah, so please go check that out.
Everybody down.
Yes, so much.
I peppered poor Sinead with a lot of questions.
Like, I don't know, but I'll figure it out. So as you see, I'm still figuring it out.
Thank you.
No problem. All right. I also did want to give you all an update on our community health improvement plan. I've mentioned this in previous meetings and with the larger coalition meeting. We are currently in the process of developing our community health improvement plan, which you will hear us refer to as the CHIP, which is essentially just a collaborative data-driven roadmap that helps us identify the county's priority health issues and to really outline shared goals and strategies to address them, all while advancing health equity and promoting overall community well-being. So throughout this process, we will be leaning on our coalition work group members as key partners. We'll be seeking your feedback as the CHIP essentially takes shape and takes form. And as a part of this effort, our data team will use the upcoming November work group meeting to share some of the key findings as it relates to the social determinants of health and access to care challenges specifically that our Prince George's County residents experience. So during this meeting, we are going to invite your insights. We need your expertise, all of your perspective to really help us identify some of the root causes of some of these health challenges and then really dig in deep as to why these exist in our community. So I strongly encourage everyone to attend November's meeting on the 20th, same time, same place. And I'll make sure to send out some communication about that as we get a little bit closer. Also note that there will be, yes, I'm looking forward to, I'm actually very excited about this conversation, Kristen, so thank you for that comment. But I do want to note that there will be no December monthly work group meeting. Just given the holiday season, there's just a lot going on. But I am encouraging everyone to join the full quarterly coalition meeting. That will be Tuesday, December 9th. So there will, again, be some communication going out. People can register since that is in person. A meal will be provided. But at that meeting, we'll share some of the preliminary findings from the work group discussions because we're having these discussions with all the work groups, and it's really topic specific. We'll also provide some updates on some changes with the coalition and really just kind of offer an opportunity to further facilitate some discussion and feedback as a whole group, because I know we do a lot within our work groups, but I think there's always great opportunity to come together. Again, collaboration, cohesion, to make sure that we're still working together as a full coalition to be successful in all of our efforts. So your input at these meetings is critical. Your perspectives are invaluable. So please, please, please attend both. Your feedback is literally going to directly inform the CHIP's priority setting and all the strategy development to come. We have action plans that we're going to be working on with the new CHIP, the CHA and everything, and some of the changes with the coalition. So everything's getting a refresh. So each step of the way will be important for you all to participate in that. So please take note of these dates. And again, I look forward to seeing everyone there. Any questions on that? And if not, I can go into our community announcements. All right, and you all can follow up with me directly if anything comes to mind later as well. So moving on to some of our community announcements. Some of you all have heard this before. MedStar is launching their safe space to support individuals and families affected by diabetes. They're promoting healthy coping strategies, enhancing self-management, and fostering some meaningful relationships with healthcare providers and fellow members of the work group. So this support group. So this group will meet every third Wednesday of the month at 11 a.m. So if you or someone you know is living with diabetes or a caretaker of someone with diabetes, please feel free to participate in the support group. Hope Connections and the University of Maryland CAP region is also hosting a support group. This is a virtual all cancer support group, which will meet on Wednesdays from 12 to 1 virtually. So please register to attend. You'll be able to connect with others, feel supported, and gain some additional resources to support your journey. Parks and Rec, Walktober. We did our Walktober icebreaker. The month is not over. I think we're halfway there, which is crazy to say. But they are just celebrating, again, pedestrian safety, healthy movement, community options for the month of October. There will be a variety of events for all ages, stages, and abilities for our Prince Georgians to get moving. So you can visit their website. You can check out this flyer for a list of events that they're sponsoring. And of course, I'll be sure to send this out in the email after our meeting. A new announcement that I have, Dine, Learn, and Move. You can join each month for 90 minutes of free virtual fun to get active, to learn tips for making healthier choices. In October session, I think there's different sessions for each month that are shared on this flyer, but October session will focus specifically on joint health and will take place on the 22nd at 6 p.m. Registration is required, so you can email the email address on the site, and there's a website that you can access on the flyer as well. Hope House Maryland is inviting all of us to celebrate their reopening on Thursday, October 23rd at 1 p.m. in Laurel. I was told that space is limited, and because it's a smaller space, they're asking everyone to RSVP because they're going to do like staggered entry times. So if you could just honor that request and let them know that you plan to attend, I'm sure they would greatly appreciate that. So the link is on the slide, but you can also scan the QR code on the flyer as well. In honor of National Substance Abuse Prevention Month, Therapeutic Links is hosting One Future, One Voice Youth and Prevention Town Hall. This will take place on Saturday, October 25th at 10 a.m. This event is for youth, families, and prevention partners. It's going to be an interactive day of learning, conversation. There's a youth-led town hall discussion and other family-friendly events for people of all ages. They're going to have raffles and giveaways and all types of fun stuff. So feel free to attend and share that with friends, family, and colleagues as well. Saturday, November 1st is the American Heart Association's Heart Walk at the National Mall. So please feel free to register to join this event. You can join with family, friends, your coworkers. If you're working with clients and they're interested, feel free to join along with them. You can walk for a mile, you can walk for 3, or you can just come and hang out. They've got a lot going on, a lot of activities and learning opportunities. So please share this out with your partners as well. The health department is hosting their virtual diabetes self-management program, or the DSMP. They are starting this next cohort on November 3rd, which is coming up very soon. So they're going to meet every Monday online from 4 to 6 p.m. Registration is required. So if you are living with prediabetes or type 2 diabetes, or you are a caretaker for someone living with those conditions, please consider registering. It is free. It will be informative. It's a great program. I highly recommend it. So yes, again, space is limited. So please make sure you register. UMCAT region and University of Maryland Medical System, they're partnering to provide free lung cancer screenings for individuals who meet all of the requirements that are listed on the flyer. So this will be Saturday, November 8th at 8 a.m. The appointments are limited, and again, registration is required. So please feel free to register, to share this flyer out. You can also scan the QR code on the flyer for more information as well. And I believe this is my last announcement to share, but there's a University of Maryland student who is seeking our help in completing getting participation for her survey. She's looking at the relationship between personality and health behaviors. So she told me there's a small incentive that's provided if you participate. You just need to be 18 years or older and a Prince George's County resident, and then you'll be able to or eligible to complete the survey. So let's help our future public health professionals in their efforts to make our county a healthier place. And now we'll open the floor for any other community announcements. Any partners care to share? All right. Well, if nothing else and hearing none, if anything comes to mind. Oh, I think I saw Anya. Anya, is your hand raised?
Sure. Thank you so very much. Just a quick thing. On October 6th, we did have Prince George's County sit as the Board of Health. And for those who might have missed it, the session was focused on access to primary care in Prince George's County. And we had a number of presenters, including Professor Nate Apathy from University of Maryland School of Public Health, who did some original research, which was presented during this session. We also had presentation from our existing medical system, Luminous Health, And we also heard from Howard University faculty plan, which would like to bring their business into Prince George's County and help us fill the gap in primary care provision in the county. And finally, we heard from Dr. Bruton from CCI, Federally Qualified Healthcare Centers. All the information is available online for those who may be interested, but it was overall a good discussion on an important topic. Thank you, everybody.
Thank you for sharing. Any others?
Yeah, I just want to remind that October is not just breast cancer month, but is health literacy month. And remember that this is a time to recognize how vital it is to make health information clear, accessible, and useful for everyone in our community. And remember that we play a key role in helping people access information and services that impact their health and well-being. And health literacy is everyone's business. And then I just drop in the chat how you can get involved. And please support us and then register for October webinar and join us our mailing list there. You can make available in the email for when you display all the announcement.
Yes, ma'am.
Shanae, could be great.
Awesome. Thank you.
Mhm.
Okay. So much going on. I love this season.
Yes.
Awesome. Okay. Well, again, if there's nothing else, if something again comes to mind later or after this meeting, you can go ahead and send it to me directly and I'll include it in the meeting notes. I'll try to have them sent out by tomorrow around noon. So if you can send any extra announcements to me prior to that, I would be greatly appreciated. But other than that, again, just our next monthly meeting is next month, Thursday, November 20th at 3 p.m. It's virtual. And again, I just encourage everyone to attend as it will be imperative to gather your insight for our CHIP. So I look forward to seeing everyone there for that conversation and just learning more about you all, what we're doing, and this county and how we can make this a healthier place to live. So thank you all so much. I'm giving you back a few extra minutes of your time today and have a great weekend.
Thank you so much.
Sure, thank you.
Thank you all for joining.